Hello everyone, I am Ivy Bastillas and I am with Karen J. Paca, Erica Jane Sanao, Maria Andrea Pacardo, and Diana Marie Billy. And today we will report about data information and knowledge. The first topic is the roles of ICT in nursing. The first role is to improve the function of healthcare system by improving the management of information and access to that information, including the management of logistics of patient care, administrative system, patient records, and ordering and billing systems. The second role is to improve the delivery of healthcare through better diagnosis, better mapping of public health threats, better training and sharing of knowledge among health workers, and supporting health workers in primary health care, particularly rural health care, including the biomedical literature search and retrieval, continuing professional development of health workers, telemedicine and remote diagnostic support, diagnostic imaging, critical decision support systems, quality assurance systems, and disease surveillance and epidemiology. Next is to improve communication about health, including the improved information flows among health workers and the general public, better opportunities for health promotion and health communication, and improved feedback on the impact of health services and interventions, including patient information, interactive communication, media approaches, health research, and advocacy to improve services. The next role is to reduce the cost. So the IT provider can save you money on the purchase of telecom wireless networking products, give you a competitive advantage, and save you money as implement new technology. So information technology can help your facility operate more efficiently in many ways, from automating repetitive tasks. Next is the seamless collaboration. So when network is working as it should, your staff always have the access to the information they need to provide and the best possible care for patients. Teams can only operate as teams when they can effectively communicate, and information technology makes that possible. So that's for the roles of ICT in nursing. Data versus information. So what comes in your mind when you heard the word data and information? Okay, so here in our discussion, we will be able to define what is data and what is information. So let's start. When we say data, it is the collection of details or data remaining in the form of either figure text, symbols, descriptions, or merely observations of entities, the events, or things with the potential to be analyzed and drawn inferences from. They are raw, which requires rendering to acquire meaningful information. Data has various forms. So we have the letters, the numbers, the images, or characters. Under the data, there are two types of data. We have the primary data and the secondary data. So what is the primary data? When we say primary data, it refers to the first-hand data gathered by the researcher himself. Under the primary data, we have the qualitative data and the quantitative data. So what is qualitative and quantitative data? Okay, so when we say qualitative data, it is the information about qualities. You can't count on it. Okay, so always remember that when we say qualitative data, we can count on it. That is, it's information about how people feel about something. Like for examples, sharing what people like about a program, how they think it could be improved, what difference it made to their lives, and whether they would recommend the program to others. So that is qualitative data. So what is quantitative data? Okay, so when we say quantitative data, it is information that you can measure. It's numbers, something you can count. Because it's countable, it can be reliable evidence. So, when we say quantitative, it is numbers, wherein something you can count. So, what are the examples of quantitative data? The examples of quantitative data is how many people took part, how much did it cost, how long did it run for, and the average attendance at each program session. So that is quantitative data. Next, let's move on to the secondary data. Okay, so let's define what is secondary data. So when we say secondary data, it is the data that has already been collected through the primary sources and made readily available for researchers to use for their own research. It is a type of data that has already been collected in the past. So under the secondary data, we have the internal data and the external data. So what is internal data? When we say internal data, it is the information generated from within the business to covering areas such as operations, maintenance, personnel, and the finance. And for the external data, it comes, when we say external data, it comes from the market, including the customers and the competitors. It's things like statistics from surveys, questionnaires, research, and customer feedback. So that is the external data. So um, let's go back. The two types of data is the primary data and the secondary data. Under the primary data, we have the qualitative data and the quantitative data. And under the secondary data, we have the internal data and the external data. And now let's proceed to the information. So, what is information? When we say information, it is the data collated to derive meaningful inferences according to its contextual requirement. Information is structured, processed, and presented with assigned meaning that improves the reliability of the acquired. Information is also ensures that there remains no uncertainty or undesirable. In essence, information exists to systematize relevant and timely data to inform or develop the ideas. Unlike data, unlike data, information is critical since it processes data through per, it processes data through purposeful intelligence to interpret or predict or explain. So for the summary of the data versus information, when we say data, data contains raw figures and facts. Information, unlike data, provides insights analyzed through the data collected. Information can't exist without data, but data doesn't rely on that information. Data has an input, goes through a filtration process, followed by a meaningful organization to generate output or the information. Data, when we say data doesn't deliver into specific since there is rarely any relevance scattered amongst heaps of data and less processed. Information is particular with correlation to the inferences derived. And lastly, when we say data, it doesn't harbor any real meaning, whereas information exists to provide insights and meaning. So that's all for that data versus information.
Question number 3. What data information and knowledge is in relation to nursing care? The data information knowledge and wisdom model depicting the megastructures and concepts underlying the practice of nursing informatics was included for the first time in the 2008 American Nurses Association Scope and Standards of Practice for Nursing Informatics. So now we're going to talk about data. What is data? The healthcare industry is data rich and data driven, yet the meaning of data to the clinician can vary depending on the use and context of this data. Data can be perceived as mere symbols, and representing the properties of objects, events, and their environments. For nurses, through their work, apply data by analyzing patient and health information such as age, gender, medical history, and medications. Clinicians need to fully understand their responsibility in the collection, analysis, and interpretation of data and their overall meaning to diagnose, treat, and provide patient care. Data comprise a collection of dates, numbers, images, symbols, letters, and words that represent basic facts and observations about people, processes, measurements, and conditions that are collected for possible analysis and action at a later time. For healthcare data can vary depending on how it is presented, such as numeric, for examples are the laboratory values, alphabetical description of anatomy or body systems, alphanumeric diagnosis codes. Clinicians need to understand the various types of data within its context to utilize and make medical decisions appropriately. Fenton identified other data types. One is categorical and discrete data. These data elements that represent mutually exclusive categories or labels. Types of data are the nominal data and ordinal data. For nominal data, this is a name category such as race, marital status, and gender, such as male, female, unknown, or other. For ordinal data, names or labels have hierarchical order to comparison with meaning attached. Diabetes can either be type 1 or type 2 or gestational diabetes, and the treatment varies, whereas cancer is categorized based on the progression of the disease, stage 1, 2, 3, and 4. Through the use of staging or differentiation of diagnosis, clinicians can have a snapshot to correlate the symptoms and order the appropriate treatment. For continuous data, we have interval and ratio. For the interval, measurement of data where the difference between the two values is meaningful. For example, temperature measurements might show two values. One is 98.7 degrees Fahrenheit and the other is 101 degrees Fahrenheit. While 97.7 is considered normal, 101 is considered above normal. The higher value can mean that the patient has a higher temperature or fever. The difference between the two numbers is meaningful as the clinician tries to understand the root cause of elevated temperature. For ratio, has the same property of interval data and has a true 0 point for example, weight can be cited as a ratio. A toddler who weighs 20 pounds is twice as heavy as a toddler who weighs 10 pounds. For the other data formats that came about as a result of the vast accumulation of data in multiple databases include the following: operational or transactional data, such as cost, inventory, payroll, and accounting. For the clinical data, diagnosis and drugs. For the non-operational data, industry sales, forecast data, and macroeconomic data. And for metadata, data about the data, such as logical database design or data dictionary definitions. The quality in terms of how data are accessed, used, and interpreted makes a big difference in supporting nurses' workflow and patient care. Accurate data help clinicians in identifying the correct problem or making the correct diagnosis, prescribing appropriate and timely treatment, and preventing complications and avoiding errors.
Now let's move on about information. So what is information? It is a group of data elements that have been organized and processed so that one can interpret the significance of the data element. So in healthcare, information is the data brought together as a logically organized, recognizable pattern within clinical system, allowing any clinician or healthcare provider to interpret and take further action or not depending on the patient's situation. For example, the height, the weight, the age, gender are data elements that could use to evaluate or to check and calculate the BMI. So the BMI can use to determine if the patient or the client is underweight, overweight, normal weight, or obese. So for nurses, RN takes a measure of vital signs and enter other data into a flow sheet every 4 hours. The data for temperature, respiratory rate, pulse rate, and shows the numerical values present this measure in a table format. So all of this data will look meaningless unless they are combined with structure or situation. Clinician or healthcare provider can analyze the numerical data values for patterns and gain useful information. Next, knowledge. So knowledge is built on a formalization of relationships and interrelationships between the data and information. According to Davenport and Prozac, describe knowledge as a fluid mix of lived experience, values, contextual information, and expert insight that provides a framework for evaluating and incorporating new experiences and information. So knowledge base, it's possible to understand that individual may have a calculated BMI that is over 30 or not to be obese. At this time, several automated decision support systems include the knowledge base and as a set of rules for applying the knowledge base in a specific situation or based in our example earlier in information. So another example is the knowledge base may include the following information. A fever or elevated temperature often begins with a chill. At the beginning of the chill of the patient's temperature may be normal or even subnormal, but in 30 minutes, it is likely to patient will have a spike in a temperature, and the rule might read if the patient complains of chills, then take the patient's temperature and repeat in 30 minutes.
For the fourth question, describe the relationship between data, information, and knowledge. So it has been a long held belief with many philosophers that knowledge is, of course, power, and that knowledge stems from understanding of information, while information in turn is the assigning of meaning to data. So the data becomes information, and information becomes knowledge. For the next slide, we will tackle about data. So what is data? So this is commonly referred to as raw data, which is a collection of texts, numbers, and symbols with no meaning. This, therefore, has to be processed or provided with a context before it can have meaning. For example, I wrote here 3, 6, 9, and 12, cat, dog, rabbit, cockatoo, 161, 175, 166, 164, 169. So these are all meaningless sets of data. They could be the first 4 answers in a 3 times multiplication table or a list of household pets and or heights of 15-year-old students. But without a context, we really do not know. In the next slide, here is information. So what really is information? It is the result of processing data, usually by computer. This results in facts, which enables the processed data to be used in contexts that have meaning. So simply put, information is data that has meaning. Next, when does data become information? As we've said earlier, data on its own has no meaning. It only takes on meaning and becomes information when it is interpreted. So this consists of raw facts and figures. So when that data is processed in two sets according to context, of course it provides us information. So information is usually the processed outcome of data. So in this equation right here, data, when you add meaning into it, it becomes an information. So let's move on to the last part, which is knowledge. For examples of information first, so 3, 6, 9, and 12, again, the cat, dog, rabbit, and cockatoo. These are all meaningless data. But it becomes meaningful when we are told 3, 6, 9, and 12 are the first four numbers in the 3 times multiplication table. A cat, dog, rabbit, and cockatoo is a list of household pets. 161, 175, 166, 164, and 169 are the heights of 15-year-old students. So let's move on. What about knowledge? When someone memorizes information, it is often referred to as rote learning or learning by heart. We can say that they have acquired some knowledge. Another form of knowledge is produced of understanding information that has been given into us and using that information to gain knowledge of how to solve problems. So knowledge can therefore be acquiring and remembering a set of facts or use of information to solve problems. So there are two types of knowledge. The first type here is the explicit knowledge. This is the knowledge that is easy to pass on to others, and this is usually contained in encyclopedias and in textbooks, and it can be found in many different medium. When we see tacit knowledge, it is a kind of knowledge that is difficult to pass on to others. For example, learning a foreign language or learning how to bake a bread. So with this, if we put knowledge into an information, it would look like this. Information plus application or use, it becomes knowledge. So for us to have an example, so earlier we say 3, 6, 9, and 12 are just data because it doesn't have context or any meaning. But it becomes meaningful when we are told 3, 6, 9, and 12 are the first four answers in the 3 times multiplication table. So what will happen if we put this into knowledge? The next slide will tell us. If we now apply this information to gain further knowledge, we could say that 4, 8, 12, and 16 are the first four answers in the 4 times multiplication table. Why? Because the 3 times multiplication table starts at 3 and goes up in threes. So therefore, the 4 times table must start at 4 and go up in fours. So the other examples earlier, the tallest student in class is 175 centimeter, and a lion is not a household pet as it is not in the list and it lives in the wild. So that's all for our reporting. Thank you.